afferent lymphatic vessels entering. It says they're carrying lymph up into the node. Within the cortex of a lymph node, you can have little follicles, little rounded clusters of lymphocytes. These are little lymph follicles, cortical follicles, and these are mostly B cells, B lymphocytes. You may have an occasional follicle that sits a little bit deeper, like this one, and look here, I'm going to draw this one right here. It's deeper. But in the deeper cortex, most of these cells are just a sea of less organized T cells. So again, in the superficial cortex, you find lymph follicles made up mostly of B cells. And in the deeper cortex, you see a sea of less organized lymphocytes that are mostly T cells. Okay. Now, as you move deeper into this region here, which is going to be the medulla, cells begin to form little cords. That are surrounded by spaces. Okay. So these little cords of cells are called medullary cords. The medullary comes from the term medulla. And these spaces between would be called medullary sinuses. And then from the concave surface of a lymph node, a little vessel that's leaving, and that would be an efferent lymph vessel. So here are your afferents. They carry lymph in. Here's your efferent carrying lymph out. Now let's look at how lymph percolates through. It's going to pass through little lymphatic sinuses present within the node. Now, let me go back for a second. When we talked about the thymus, we said that the epithelial reticular cells tended to form a stroma, a mattress upon which the lymphocytes sat. In the lymph node, you also have a stroma, but it's reticular connective tissue. We talked about that in AP1. And that reticular connective tissue includes a network of crisscrossing reticular fibers. Okay, you remember that? Okay, and these reticular fibers form the support for the lymphocytes. In fact, these fibers crisscross the sinuses that are present within. And so immune cells can sit on those fibers. When lymph first enters into the lymph node, it's going to pass into an area called the subcapsular sinus. This is a little space that sits between the capsule and these lymphatic follicles. Now I'm going to show you a little area here where there's a septa. So the extension of the capsule in, and there are other septa like this. And usually alongside these septa or trabeculi, there are spaces. We call these spaces trabecular sinuses. So lymph is going to travel from the afferent lymphatic vessel into the subcapsular sinus and then down the trabecular sinus. It comes down like this. Now, from the trabecular sinuses, the lymph is then going to percolate through these medullary sinuses to reach the efferent lymphatic vessel and leave the node. But as I mentioned, these sinuses are crisscrossed by tiny reticular fibers on which sit, for instance, macrophages or other immune cells. And so if that lymph is carrying foreign material, it's going to be recognized by the macrophages that will engulf it. And those macrophages will present little fragments, antigenic fragments, to B lymphocytes in the superficial follicles and T cells in the deep cortex. Okay? And in response to activation by that foreign antigen, these B cells will begin to proliferate, or the T cells will begin to proliferate to mount immune response. Now, if these superficial lymphatic follicles, okay, if B cells within those follicles are exposed to an antigen and become stimulated, they begin to divide. And the character of the follicle changes. Instead of simply being a dark, dense, homogeneous collection or cluster of B lymphocytes, the follicle develops a lighter staining interior region called the germinal center, where the proliferating B cells migrate. So if you see a follicle that has a germinal center, you know that it's reacting to an antigenic challenge. A follicle with a germinal center is called a secondary follicle. Whereas if you have a follicle like this without a germinal center, we simply call that a primary follicle. Okay, so with that introduction, let's read what it says about these lymph nodes. Bean-shaped organs less than 2.5 centimeters in length. It says the superficial cortex contains densely packed follicles containing B lymphocytes or B cells. The deeper cortex houses T cells, which are typically, many of which are in transit. In other words, they've stayed there for a while, and some of them are either coming in or leaving. Okay. And then when you reach these medullary cords, these cords are made up of a collection of cells that includes both B cells and T cells, and then B cells that are formed plasma cells. Okay, so it's more of a heterogeneous group of cells. The medulla, in addition to containing these cords, they contain lymph sinuses, medullary sinuses, okay, where lymph then percolates to reach the efferent lymphatic vessel. This is another diagram of the lymph node. And again, you can see the subcapsular sinus that's being crisscrossed by the reticular fibers. This would be a trabecular sinus on either side of the trabecula. Down here would be a medullary sinus that's emptying into the efferent lymphatic vessels. By the way, one thing I did point out earlier is that lymphatic vessels are more like veins than arteries, meaning that they have a very thin wall and they possess valves, which provide for unidirectional flow of lymph. Now what you might want to do is put a big old circle over this little box here, because it depicts the flow of lymph from point A to point B to point C to point D. That's nice. Now, let's talk about the spleen. Okay. Is the spleen a primary lymphatic organ or a secondary lymphatic organ?
Secondary.
Secondary. Where does the spleen live?
The stomach.
Not in the stomach, that's a different organ.
By the stomach.
You would say abdomen. But where in the abdomen?
The left
Upper quadrant. Yeah, the left upper quadrant. So, as a result, whenever someone comes into the emergency room with left upper quadrant abdominal trauma, they have a ruptured spleen until proven otherwise. If the patient needs surgery.
I know.
Because they can bleed out internally.
I'm saying, like, what do they do to the spleen to fix it?
Sometimes
They
they
remove
take it out.
They're just
They take, sometimes it can be repaired, but if it's a relatively minor laceration, but in many cases, it's not so minor and they simply have to remove it.
So whenever earlier you were talking about without a spleen, you're more susceptible to sepsis.
Right.
Do they do anything prophylactically if they have to take it out?
Yeah, for instance, if you don't have a spleen, you have to get, for instance, the pneumococcal vaccine every 5 years. And part of the reason is that you're particularly sensitive to encapsulated bacteria. Okay? And those strep pneumoniae are encapsulated. You remember, you take micro and you learn which bacteria are encapsulated versus which ones aren't. Well, the encapsulated ones, one of the protections afforded to the bacteria by the capsule is it helps it to evade phagocytosis. So if you have a pneumonia, okay, from pneumococcus or strep pneumonia, many of those organisms, because they have a capsule, can escape phagocytosis and reach the bloodstream. Okay? Now, if you simply have a bacteremia and an intact spleen, the spleen takes care of it. But if you don't have the spleen, then it allows those encapsulated bacteria to proliferate. And they can start producing inflammatory mediators within the bloodstream that can lead to sepsis. They can cause hypotension and fever and all these things. And they can kill you. So without a spleen, you know, if you had your druthers, you'd rather have your spleen. I like to keep all my stuff. Okay. You know, some people are very generous and they donate blood and donate kidneys. I don't think I'm that person. Okay. So it lives in the left upper quadrant of the abdomen. It's the largest lymphatic organ. Okay, we'll take a look at it when we dissect the abdomen within the dog. Now, the spleen can be subdivided when you surgically, if you remove the spleen and you open it up. Okay, there are patches of what are called white pulp interspersed with patches of red pulp. This term white and red pulp refer to the appearance of the vital tissue, the living spleen. Now, once you remove a section of it, okay, and mount it on a slide and stain it, then the white pulp doesn't in fact look white. In fact, the white pulp stains more deeply than the red pulp. So the white pulp looks darker. It stains like a purple or more, you know, a more dense color. So this white and red pulp refers to the living spleen, not necessarily what the spleen would look like under the microscope. All right, you may remember that the splenic artery is a branch off of the celiac trunk. When that splenic artery enters into the spleen, okay, what happens is the spleen's encapsulated. Let's use red for this. And as with other lymphatic organs, this capsule sends in trabeculi that extend deeper into the tissue. Well, branches of this splenic artery then enter at the site of these trabeculi. Draw branches. And as they leave the trabeculi, and the trabeculi don't extend terribly deep into the spleen, these branches become what are known as central arteries. So what I'm drawing here are, we'll think of these as central arteries. Arteries, The central arteries are surrounded by white pulp. And this is tissue that appears more pale in living conditions. It's like a sheath or a sleeve that surrounds the central artery, this white pulp. Okay? And the white pulp consists of lymphocytes and macrophages. So you see lymphocytes and macrophages. Surrounding these central arteries. I'm not going to do it on all these central arteries, but I'm just demonstrating here. Okay? Now, within the white pulp, these central arteries are subdividing into progressively smaller arterioles. They're extending out away from the central artery. Now, any tissue that is outside of this sheath of tissue, outside of the white pulp, is called red pulp. So basically, all the rest of the splenic tissue is made up of red pulp. Okay? And that red pulp, and think of this, compare this kind of to the medulla of the lymph node, consists of cords and sinuses. Except these sinuses, instead of being lymph sinuses, these are venous sinuses. They're sinusoidal capillaries, type of dilated capillary. And these venous sinuses are surrounded by cords of lymphatic tissue called either splenic or Milross cords. Now, unlike the white pulp, which consists mostly of simply lymphocytes and macrophages, these splenic cords contain all the formed elements that are found in blood. They include red blood cells, white blood cells, and platelets. And the white blood cells include abundance of lymphocytes, plasma cells, as well as macrophages. In other words, cells of our immune system. What's different about the splenic circulation compared to any other circulation within the body is that it's an open circulation.